COVID has proven just how fragile and precarious not having universal healthcare is for any society, and including capitalism, unless, as NATO says, you're just fine with everyone dying. And it seems like, ultimately all the like hemming and hawing about like, oh, workers have too much power. I mean, obviously they're mad at any stimulus money, but it's also like, gee, maybe we do need to keep people minimally more healthy. There should be sick days, universally, no matter if you're, what your condition is. Do you think this is a moment ripe for a concept like health communism, or like rethinking our definitions of healthcare and health?
Well, part of the reason why we wrote the book is because my co-author, Artie, who's also a co-host of Death Panel with me, he and I have been people who work on health justice and Medicare for All or state single-payer campaigns for many years now. And part of that is out of self-interest, which is that, I have fucking expensive medications, and Aetna never wanted to give them to me, nor would Cigna, nor would any of these companies, because I wasn't profitable. I cost $350,000 a month. There's no upside for them. Jesus. So that's what pushed me into the high risk pool. And really, more than anything else, is like making me eligible to certify as disabled in the United States. And so, one of the things that's been missing from the conversation around Medicare for All is why we give a shit about cost. Yeah. Why do we care about reducing costs? Why is the left going around saying Medicare for All is great because we're going to save money? Well, it's fundamentally, I think, a dangerous way to advocate for universal policies, right? Like when we start talking about something being a good reform because it saves money, one, it's also fucking boring. Like, who cares?
Yeah. Right.
Really sounds like a lot more fun to be like, let's organize a bunch of people together to work on this campaign for Medicare for All, because if we could have one payer, then we could think about our health insurance more like we think about union power, where we could start to say, okay, yes, we have one payer, and that might reduce costs, but most importantly, that creates a bargaining unit. Yeah. If I can't get a drug in my state and you can't get a drug in your state, we're on different plans. I can't do shit to help you get your drug if I get mine.
Right.
But if we had Medicare for All, we had one payer, it's like the IWW approach to unionization, except for flipped onto health finance. And so part of what Artie and I, wanted to do when we started Death Panel was really try and talk through some of these conversations around Medicare for All that were just not happening, which is like, how do we do healthcare for non-workers? How do we do healthcare for everyone, even if it costs more?
Comedians.
And why is it worth it?
Comedians, especially. Partially employed people.
And it's frustrating because I think that there would be a lot of rhetorical value to the left to start to think about how we can create workers' movements that work for non-workers too. Because the non-working position, the position that I'm in, like I might not look super sick and disabled to your viewers. Like they don't know that I can't see very well. They don't know like what I'm like when I'm not in front of the camera, but like they probably would have a difficult time picking me out from a crowd and saying she's definitely disabled. What disables me in many ways is my
I think we can
disease.
all agree, though, that the listenership of the Bitchuation room should be the people deciding who's eligible for disability and not administrative law judges.
Yeah.
That would probably be better. Yeah.
It would be. But Frantifa is very gracious. Mm-hmm.
What makes me disabled is like that I could never get a job that would give me enough sick days just to go to my infusion appointments, which are 2 days every 4 weeks, and go to the doctor. Like I wouldn't be able to get sick above and beyond the sick days that I already had. I can't work a job that doesn't give sick days because I would need those. And so when we live in a massive,
we live in a massive Squid Game for healthcare. That is what this country is. It is, you're fine so long as you don't step on the landmine of getting sick. And guess what? You're going to get sick. It's not a question of if, but when. It happens. Sorry, I didn't mean to interrupt you.
No.
Yeah.
No, honestly, collaborative speech.
Yes, like collaborative speech. I wanted to actually, this is so random, but health for me also more broadly means like, time with your friends and family, time off, you know, enjoying life, not living to work. I think as someone who's lived outside of this country, it is very, you have culture shock when you get back into the States and people are like, oh, hi, what do you do for a living? It's the first words out of your mouth when you meet somebody, you know, and it's just bizarre and you feel yourself doing it. And you're like, it's basically like, well, I'm sorry, what's your reason for living? And you're like, I'm a fucking person. Is that okay? I posted something on Instagram that totally triggered people. And it's kind of this like low key anarchist like meme. I don't know where it comes from, but it says, I didn't go to work today. I don't think I'll go tomorrow. Let's take control of our lives and live for pleasure, not pain. And I posted it on Labor Day. And people were like, well, I think it's important to work and I don't, and we just, part of that revolution of health, again, to your point of thinking bigger than Medicare for all, is about rethinking our relationship to work and who is deserving of, a day to sleep in, a day to rest. Like reclaiming rest, you know, versus being like, no, grind set mindset, bitch. Like, and like it's so bad.
Yeah, no, and also then, you know, if you do get so sick that you're like me and you're fucked and you're so fucked that no one will hire you and you're so unprofitable that no one will insure you, and so you fall into the crack and the safety net catches you. You know, in exchange for Medicare, my income is capped at like $13,000 a year.
Jesus Christ.
So like I am labor discipline. The poverty imposed on me as a disabled person by our safety net program is a reason for other people to stay in their shitty jobs, because if they ever got so sick that they needed SSDI, you know, it would be a huge blow to their income. And the other thing is that we don't give SSDI to everyone. People who are disabled as children who never work, they don't qualify for SSDI. You have to pay into the system to prove that you could work at one point to qualify for SSDI. People who were disabled as children who were never able to work, they're on this other program. It's called SSI, Supplemental Security Income. And they don't even get Medicare. They only get Medicaid. So they're subject to rationing. Some people in Texas have a maximum of 3 prescriptions per month. And then you layer onto that the privatization of COVID, and they're pushing COVID to the private market. And the Biden administration's plan is that they're going to fucking beg insurance companies to get rid of copays. Like, I'm sorry. You know, I just feel like there are better ways to be talking about Medicare for all that give us tools against some of these rhetorical moves. But one of the ways that we're so used to talking about is like, workers deserve this, it's going to save money. And I think we have to move beyond it.
Beatrice, I like you even if capitalism doesn't.
Thank you. Same.
So I work for a union and mostly organize with safety net healthcare workers. And so one of the things we run into all the time is like the city will say, you know, there's not budget for the staffing that you need. And then we say, well, then the budget is wrong. Like you know, the budget should be whatever our patients need to be taken care of. One thing I wanted to ask you about is how you think about how you apply this critique to conversations about evidence in like how healthcare is delivered and created. Like how does it the logics that you're criticizing about sort of about how much capitalism and expectations about capitalism and assumptions about productivity infuse all of our understandings about healthcare? How does it come up with even how we talk about sort of what is seen as like purely dispassionate evidence about future treatments or whatever?
Well, I think one thing that we also try and do in the book is make an intervention towards a left internationalist understanding of health. Because if I think in COVID is a good example of why we need something and some sort of global scale intervention, because it's not like if the United States fixed all of its healthcare problems, all of our health, you know, finance issues, and got everyone Medicare for all, that everything would be fixed and perfect, right? There would still be these other systems that we would need to tackle, and many of them are in other countries. And the problem with the US model of care is that companies in the US, you know, have exported it around the world. one of the things we talk about in the book, for example, is like, you know, the World Trade Organization making adopting private healthcare markets compulsory to certain other types of funding. So we tricked the world into adopting our bullshit, and other countries have not necessarily taken it on the way the US has, but the US basically has as many different types of insurance plans just in the US as we have throughout the entire world. So some of the things that we can do here actually, I think, teach us lessons for things that we can do at a global scale and sort of do in terms of like thinking about how also our advocacy for various health programs will affect other people in other countries. Because when in the US, we say like, oh, we just want like what Canada has.
Right.
People in Canada are like, well, I can't get my fucking medication either.
Right.
Right. So we have to sort of start thinking about how these logics of extraction go beyond the individual, beyond the community, beyond the nation, actually into the kind of population as a whole, which whether you're marked surplus like me, or you're just in the kind of queue to become surplus, we are all treated as raw material by global racial capitalism, and our politics should reflect that.
Mm-hmm. You know what I'm just struck by, because I feel like you talking about, what is it, the administrative burden, I call it just like, you know, insane bureaucracy, that people, especially the right, who all can buy their way out of any kind of, you know, disability or you know, whatever, anything, tragedy that befalls them, like, is that it reminds me also of the immigration system. You don't understand how utterly bureaucratic and fucked it is unless you're in it, unless you're trying to get care, unless you're trying to get citizenship, unless you're trying to even just be legally chill in this system, you know, or whatever it is. And it's like, you know, right now people are being kicked off their Medicaid, and you hear these stories, you know, these moms, they gave birth and they had, you know, they had health complications, their kid had health complications, but then they made too much money in their like 15-hour-a-week jobs to then still qualify. They're being kicked off, their kids sick. Like, it's just, it is so sinister. It is so cruel what we do to people, to our own people. And like you're saying, we are all just kind of cannon fodder / you know, worker bees. But I want to ask you then, if it is international, why communism? Why, my little like spidey sense goes up, is like, you know, it's like, why communism? Why does it have to, and like, does that sort of, it makes me think of like, oh, what about China or like Cuba or other things like this?
Yeah, I mean, I think it's important to say, like, so it's small c communism.
Got it.
So like the idea, not the brand. But it's also because we're calling for a reorganization of the entire political economy. So in some ways, socialism, well, I'm not disparaging socialism by saying that our goal on the horizon is health communism. I think that in a lot of ways, though, if we don't push past some of the iterations of socialism that we already know and we already see in political economies throughout the world, whether that's the NHS in the United Kingdom, whether that's things like the kind of Scandinavian model, there are a couple different existing models of socialist healthcare.
Mm-hmm.
Those are all still based on austerity and rationing. And things like the NHS even have like artificial markets inserted into how it runs in order to create efficiency inspired by American management consultants, of course. So part of why it's health communism and not health socialism is that we are actually, you know, we are calling for a reorganization of the entire political economy, not just kind of the essentials, actually, because you know, we have to take a look at sort of our total health industries, and that actually goes much broader beyond things just like medical care. And I think we have to start thinking about what are the kind of other parasitic industries that also you know, extract from us and are basically regulated as if like the government's job is to facilitate their extraction from us, right? Like so like so much of health policy is about making us available.
Ticketmaster.
Yeah. So I mean, it's it's not that it's like anti-socialist or that we're like, oh, we're too cool for that or something, and we're not trying to be edgy. Like the Matt Iglesias has accused us of like only picking this title just to piss people off. This title's there because it describes the opposite of what we live with. We live under health capitalism, and there is no named version of what we don't have a name for the system that we live in. So in naming the opposite, we can also kind of crack open political will, crack open the political horizon, and stake a claim for, you know, something bigger, a non-reformist reform beyond anything that the left has actually imagined before. Like, why stop with Medicare for all? This should be the floor, not the ceiling for how we're conceptualizing how the left can build power, you know? And I think that's really kind of our goal here. Obviously, you know, in the United States, using the word communism is a provocation, no matter what. We've made sure of that. But it, I think, is a necessary discussion about really, you know, how many industries does this touch? How many different ways is your health commodified? It's not just your insurance company. It's not just your doctor.
But you know, what I like about using the C word and the lowercase c word is the way that when you start to argue against it, you sound like a sociopathic asshole. Like, you know what I mean? Where you're like, well, it shouldn't be each according to his need. Cause like, what if I also want to have vision problems and take more meds? Like what, you know what I mean? Like you cannot truly, and that's why private insurance companies never give interviews. They only work behind the scenes because they know that they are working in an indefensible industry that has failed the American people time and time again. They know they're evil. They know that. And you cannot defend a privatized healthcare system anymore. And so I like that because it is, you know, everyone should have what they need, and there should be no barrier to giving, because this, you know, you're always told, oh, communism is rationing. Bullshit. Capitalism is rationing. You've just explained how that happens, and we live it every single day in this country, how it happens. And I like also that you're saying no mixed economy. No. None of this mixed economy market bullshit. No market involved in health. I think that's planting your flag or stake or whatever on that
is the hill. Yeah.
There you go. Yeah. I mean, it's provocative but for good reason. Last thing.
The critical question is, what are the first sectarian splits coming in health communism?
Yeah,
like,
exactly.
Who is calling for health Maoism?
What's going on, Frantifa? If you haven't already, subscribe to this channel right now. Hit that button. And also, you can become a patron and support the show every single week. Get access to bonus episodes and exclusive merchandise. Patreon.com/Bitchuation Room. Do it.